CASES was formed in 1989 to improve how the criminal justice system responds to a range of high-need populations. These include adults with severe mental illness, women with significant experiences of trauma, and youth returning to the community following incarceration. Most of our participants are unemployed and without education or housing. Many have complex criminal histories and treatment needs that jails and prisons are simply not equipped to address. CASES gives our participants the opportunity to remain in the community by providing supervision to ensure public safety while offering the treatment and support they need to achieve real and lasting change. Over the years, CASES has evolved beyond simply diverting people from jail or prison. Our current programs provide a range of rehabilitative and support services. These services are specifically designed to meet the unique needs of youth and adults involved in the criminal justice system. On a systems level, CASES seeks to establish innovative solutions that improve the effectiveness of public policy and practice. On a service level, our goal is to address the support and treatment needs of the thousands of individuals we serve every year, with the ultimate goal of helping them to avoid further involvement in crime and to live safely and productively in the community. What makes CASES unique is the extent to which our programs are embedded within the fabric of the criminal justice system. CASES staff work in courts throughout New York City, and our programs for youth and adults include partnership with key stakeholders in the fields of criminal justice, mental health, education, employment, and public housing. With the support of private and public funders, CASES works with our partners to address service gaps as they emerge and to seize opportunities and implement innovative solutions that will improve outcomes for the individuals involved in the justice system. CASES has worked extensively with criminal justice and mental health experts to develop screening and assessment protocols that help us to determine the risks and needs that make our participants susceptible to involvement in crime. Our staff use assessment results to develop treatment and service plans that are uniquely responsive to each of our participants' individual risks and needs. Many of the people we serve are resistant to change, and a key emphasis in our work is the use of evidence-based practices that build our participants' motivation and commitment to engaging in treatment and achieving lasting change. A key metric for CASES is the reduction of our participants' involvement in crime. In our program for adult felony offenders with serious mental illness, assessments indicate that 87% of participants are at a medium to very high risk of committing another crime. However, in recent years, none of the participants who successfully complete this program have been convicted of another felony within 2 years. In our program for young people ages 16 to 19 who have been convicted of a felony, assessments indicate that 67% of participants are at a medium to high risk of committing another crime. Of participants who graduate from this program, more than 80% have no arrests within 2 years. A critical misconception is that public safety is achieved only when people who have committed a crime are removed from the community. Our programs have consistently reduced the recidivism of youth and adults involved in the criminal justice system, demonstrating that in many cases public safety is actually best achieved by keeping these people in the community and helping them to lead more stable, productive lives. CASES began as an organization that operated only 2 alternatives to incarceration programs. Over the years, we have evolved into a multi-service organization that provides award-winning mental health treatment services, a nationally recognized youth employment readiness program, on-site GED classes and testing, college access and retention services, and supportive housing for participants with mental illness. CASES is proud to be a leading provider of programs that have contributed to significant declines in both incarceration levels and crime rates in New York City. One of our challenges at CASES involves helping participants overcome the stigma attached to previous criminal involvement. For many young people, it results in a serious disruption of their school attendance and often contributes to their dropping out. Involvement in crime can also have a lasting impact on a young person's ability to secure employment, especially in New York, where an offense committed at age 16 or 17 usually results in an adult criminal record. We give them a second chance to pursue an education, and we engage them in work readiness training and meaningful internships so they can gain work experience, build resumes, and realize a wider vision for what is possible in their lives. CASES Primary Youth Program provides a 6-month alternative to incarceration that includes education, employment, mental health, and substance abuse services. Over the past 2 years, we've implemented a pilot program that has enabled more than 50 justice-involved youth to enroll in college. This is a remarkable change in these young people's life trajectories. With additional resources, CASES could expand this program, providing more robust aftercare for our program graduates. In recent years, both the number of people incarcerated and the crime rate in New York City have declined. At the same time, the number of youth and adults with mental illness who are incarcerated in city jails has continued to grow. Those with mental illness remain in jail nearly twice as long as individuals who have committed similar crimes but who are not mentally ill. And despite their longer periods of incarceration, roughly half of those with mental illness will be rearrested within a year of their release from jail. To address this challenge, CASES has developed a range of specialized mental health services, including a new state-licensed outpatient mental health clinic. The CASES Clinic will provide innovative treatment, rehabilitation, and recovery services for justice-involved individuals who have mental illness.